Welcome to the dvm360 Fear-Free Google Plus Hangout on Air, a special online event to take the pet out of petrified. I'm Mindy Valcarcel. I'm the editor of Veterinary Medicine, and today with me to explore the topic of fear-free practice is Dr. Karen Overall. She's a board-certified veterinary behaviorist from the University of Pennsylvania. Dr. Overall speaks around the world on veterinary behavior and is the author of numerous journal articles and books, including the Manual of Clinical Behavioral Medicine for Dogs and Cats. And she writes regularly also for dvm360 magazine. And we also have Dr. Marty Becker. He is the Veterinary Economics Practice Leadership Editor and practices in Northern Idaho Animal Hospital in Sandpoint, Idaho. He's known as America's Veterinarian, and he's the spokesperson for the veterinary profession, and is also the author of numerous pet care books, including Your Dog, The Owner's Manual, and Your Cat, The Owner's Manual. So let's get started. Throughout the Hangout, the audience, talking to you guys, feel free to submit questions as we go through, and at the end we will have a play time that we will be addressing your questions. So, first off, both Dr. Overall and Dr. Becker, why is a fear-free visit better for pets, and kind of what is fear-free?
Do you want to go ahead, Dr. Overall, or do you want me to take the first shot?
You can take the first shot.
Well, I have to say, first of all, Dr. Overall, you'll probably hear in a minute, is the reason why I got involved with creating fear-free visits for pets. That she, has pioneered this for 20-plus years. So, without this lady who's been a colleague of significance and now a friend of significance, I wouldn't be on this journey. That when I was kind of in the glide path towards the end of my career, and all of a sudden did the pull up, because I want to make sure that we can create fear-free visits for pets. Basically, I'm going to tell you two stories about creating fear-free visits for pets. This is how simple it is. Dr. Ross Clark, who many of you know, was my mentor. When I was in veterinary school, I read everything he wrote in veterinary economics. I was fascinated in the business, customer service, leadership side of veterinary medicine, and as Mindy explained, I'm still the practice leadership editor. So I built several successful practices, 7 to be exact, big hospitals. And so to run a successful hospital, you had physical well-being, the pet's physical well-being in one hand, and the other hand was this casserole of things. It was customer service, leadership, sales skills, motivation, marketing. And that's what I've written about, that's what I've talked about for years. Same with Dr. Ross Clark, who built successful hospitals. But a couple of years ago, we were at the 25th anniversary of the Central Veterinary Conference, and we were talking about how it had changed. And now, creating fear-free visits, you got the pet's physical well-being in one hand, but the other hand is the pet's emotional well-being. And so those two things hand in hand, that's what creates a fear-free visit. And if you're going to pick between the two, you're going to look after the pet's emotional well-being first in most instances before you toggle to physical well-being. And the other story I want to tell you is Dr. Steve Ettinger, who most of you know and have his book on your bookshelf. It's probably on Karen's behind her. It is in my bookcase behind me that you can't see. And Dr. Ettinger, I was talking to him at the AVMA meeting in Chicago in 2013. We sat on 3 of us for dinner. What are you doing? What are you doing? And I told him about fear-free, and he got kind of choked up. And I thought, what did I just say? And he said, listen, I've been working in a traditional veterinary hospital 2 days a week and a veterinary rehab facility 2 days a week. The resting heart rate in the rehab facility is 90 to 100. The resting heart rate, the same pets in the traditional veterinary hospital, is 140 to 150. So 50 to 60% higher resting heart rate, the same pets, the king of internal medicine. And then he came back to me 6 months later at NAVC and asked to join the Fear-Free Advisory Board. And I asked him why, and he said, listen, it's better medicine. You got a more normal TPR, more normal blood pressure, your blood work is more normal, your physical exam, they don't hide the pain and sensitivity behind all this anxiety and fear. You don't get the immunosuppression, you don't get the digestive upsets. But they'll never forget this. He goes, forget all that. It's the right thing to do. And he was going back to his oath to prevent or mitigate pain and suffering. And it goes back to that thing that's medical bioethics around the world, the first do no harm. And right now, in most hospitals, right today, every patient that's seen is going to suffer some kind of harm because of what we're doing or what we're not doing.
What do you think then are the benefits of a clinic becoming fear-free? What will that do for the clinic?
Well, I can tell you from the clinics that we've been working on that for almost 5 years now, it depends on what you want to look at the benefit. Everybody benefits. The pet benefits because it's not in fear or anxiety. The pet owner benefits because they're not as much fear as anxiety. And this is everything from the fear and anxiety that starts in the living room that continues into the car, and then you got a pet that's anxious and barking or has fear-based aggression in the reception area and they're embarrassed so they don't want to bring it in. That's why pet owners aren't coming in. It's not worth the hassle to them or the hurt to the pet. So you get increased client visits, dramatically increased client visits, which is an obvious benefit. There's more safety. You don't get the number of fear biting, but it's much more rewarding. I mean, I've asked people, Dr. Overall and I spoke at CVC DC, and I think Karen expected 50 people, and we had 650 people. And when you ask people about how many of you hate to take your own pets to the vet, a sea of hand goes up. It's not an abstract idea. I think I know what you're talking about. Let me stew on this, and I think I'll understand. We all hate to take our own pets to the vet. So, what you're doing is provide. Nobody should fear a trip to the vet, not the pet owner. And what do you think, Karen?
It's such a good question because the real benefits here, the real value in this is that you get to see the real animal. Veterinarians seldom get to appreciate the dog or cat behind the huddled mask. And if they're not terrorized, not only are all of those physiological and physical factors now interpretable. People are paying hundreds of dollars for lab work, which we may not be able to interpret because of the stress level. But if they can have fun, if they can show you some parts of their pet's personality, if they can learn something, everybody's stress level decreases, and there's value added. And I know everybody's worried about currencies in terms of money and cash flow. But what people may not realize is that if you've got somebody who's got a pet who's worried, they are the most committed of clients. And if you can do something to alleviate that concern, these people are going to do everything that you want to do to help this animal. So if you can get them past that fear, think of it as an investment in your practice. And if you're not a capitalist, it really is the right thing to do. And you'll feel better. If you can smile and the client hugs you when they leave, you made it work.
That's great. That's great. I think that both of you, you've been kind of spearheading this movement, and I think that you both have particular patients or situations that made you realize the importance of fear-free in practice. I was wondering if you could each kind of just tell a little bit about those stories.
You start, Karen.
I'm very honest about the fact that my life changed because of one dog. And in fact, he's the dog who is doing the behavior mod video that's with my new textbook and also available as a separate DVD so clients can take it home. He's the dog who demonstrates all the behavior mod. His name was Flash, and he was my patient. And he put 3 people in intensive care. And when he put his 3rd person in intensive care, the people who had adopted him couldn't keep him. He'd been in 3 shelters. The shelter was obviously not going to put him up for adoption, but somehow between the 3 a.m. emergency visit and 6:30 in the morning when my pager went off, they had arranged with the shelter staff that they could sign the dog over to me. I didn't want him. You need to know that. So not only did I end up with a very aggressive dog, I wasn't enlightened enough to want him. And he completely changed my life. And he changed my life because the basic things that you would expect to be able to do to most dogs and cats, you couldn't do to him. He had to participate willingly in every exchange. And as a result, as he got better, and I never thought he could get better, but he became not only normal, but supranormal. Everything had to have a part for him to participate in. So since I knew he was going to need veterinary care at some point, I'm not going to put my colleagues at risk by asking them to take on a dog whose history they know. So I taught him to offer his body parts for veterinary care. And because he was so charming, it would be interesting after he did that, 5 or 10 minutes later, to realize that the clinicians and the staff are petting this dog and stroking this dog and saying what a nice dog this is. And this is the dog they wouldn't have gone in the room with. So Flash pretty much made me live up to my own standards. I've been telling students for years that we had to stop threatening animals and that we shouldn't be using restraint. It was scary for them, and maybe we shouldn't be using restraint. Maybe what we use we shouldn't even call restraint. That we had to consider the dog or the cat as the individual. They're not a case. They're who they are. And trying to teach students to be more humane. And then I realized that living it was a lot harder than saying it. And when I had no choice with Flash, because my choice was to have a dangerous dog who wouldn't get health care, or what I thought was going to be a less dangerous dog who could get health care, I chose the latter, and that dog stunned me by teaching me how distressed pets can get and how much they can change. And I owe every bit of the modernist thinking that I have to him. And he made me change the way I teach medicine, and he made me change the way I think about mental illness in pets.
You know, if you see me leaning down sometimes, I'm writing down stuff Dr. Overall is saying. You know, like the part about getting to see the real animal, that's just another insight into, you think about that, and getting to, once you get past the fear and anxiety, getting to see the real personality show. You know, I want everybody to know I'm not somebody that has some special gift as it relates to this, nor special training. And it's not like I've been a veterinarian for 35 years, and I, it's not like I pioneered this or only I have this gift. In fact, before we worked with R.K. Anderson and did a few things. We gave a lot of treats and did some things, but it wasn't until I heard Dr. Overall speak at a meeting in Canada where she said, fear is the worst thing a social species could experience, and it caused permanent damage to the brain. That simple sentence. I was in the back of the room. I can remember exactly where I was sitting because I talked to another guy that was sitting right next to me that had the same kind of epiphany. I talked to him at a later meeting, and Dr. Overall was up in the front of the room, and she gave examples of fear and anxiety in humans with near-death experiences and somebody in the hospital you didn't think would make it, and then gave the signs of fear and anxiety in pets. And I realized I knew most of them, but the problem was some of the ones I thought were good signs were actually bad signs. That was troubling. That'd be like hearing a white blood cell count is good for infection going down. And then the other thing was I'd never stopped a procedure based on fear or anxiety in a pet in none of the 7 hospitals I'd had. I'd never seen it done in any of the hospitals I'd been in. When a surgery alarm goes off, my God, we stop this, we start this, we increase this, we decrease that. Everybody takes action. But with a pet with extreme anxiety or fear, just kept auguring them through the system. So I kept thinking about that. Physical well-being, that's all we're focused on. And then customer service, motivation, marketing, leadership, zero regard for the pet's emotional well-being, and we're causing permanent damage to the brain. So, that's what started it for me. And then realizing, well, we have an urgent obligation, an unprecedented opportunity if we do this. And then in getting to know Dr. Overall, back she was 19 and as a student going into epidemiology study in these Children's Hospital of Philadelphia for oncology. Just think of this: the dependent patients in human healthcare are children. And we both grew up in the healthcare system, as she calls it, of the 50s and 60s, where we were manhandled, manipulated, abused, basically. And she went into this hospital, and they weren't. They had to take their medication. They could decide when to take it, how to take it. You want to take it with a milkshake, you want to take it at supper time. If you have to have an IV, you don't have to be stuck in bed. You can go out and take a portable IV stand and go out and play with your friends. Are you comfortable? Can we change the TV channel? You need more blankets, everything for comfort and emotional well-being of children. Then she goes to veterinary school, and what happens to the dependent beings in veterinary care? Pets. Manhandled, threatened, manipulated, abused. So then she talks about those, so that got her, but still she was suppressed until she got Flash. And what's interesting is get to know her. I was always a little scared of Dr. Overall's intelligence, not her demeanor, but I was always kind of scared of her, like a lot of us are. So I could still remember as I've gotten to know her, what a joy. But to hear her talk about errors and cowardice, I don't know how many of you out here that have been fans of hers for years, but those aren't words you would associate with Dr. Overall. But there she talks about her errors, her cowardice, but how that dog taught her. And now it's just getting more and more so. Once you see this, once you see the signs of fear and anxiety, once you know what it's doing to these dogs, and we're causing repeat severe psychological damage because of what we're doing or what we're not doing, you can't look away.
Well, I think you talked about epiphanies, and I hope we're having similar epiphanies as people watch this Hangout. So if people are inspired to start, what are the first steps in building a fear-free practice?
Let me start taking a stab at that, because I can tell you the low-hanging fruit you can do that's going to get you quite a bit the way there. The first thing is you got to teach the pet owner that their responsibility for taking a pet to the veterinarian has to fundamentally change. There's my daughter Mikkel and a veterinary behaviorist named aborted veterinary behaviorist, Wailani Sung, are actually working on a book about how to get them from the living room to the exam room, and it's quite a process. So I won't go into all the details, because that is, it's literally step by step of when you put the carrier out, what you put in the carrier, how you put it in the car that but I'll just kind of give you the basics, okay? For these pet owners, if they're going to put the pet in a carrier, have them get the carrier out a few days before and give some high-value foods in it. Either feed them in there some high-value treats. Put it in the car. Don't put them inside the carrier in the house and go swinging with that thing like Six Flags over wherever you live, Bonners Ferry where I live. Go flying into the car. Put the carrier in the car. Put it on some towels or something so it's flat, and cover the carrier with something that reduces the visual stimuli. And tell these pet owners not to talk to their pets on the way in. Certainly not baby talk them, which increases the pet stress, and that increases their stress, and it goes back and forth. Tell them not to feed the pets after 6 p.m. the night before unless it's medically contraindicated, so they respond better to food rewards. And some of these pets were using chill pills, Angstitane, Zilkine, which are one's a milk protein, one's a green tea extract that you can start 12, 6, and 2 hours before the visit can really help. Once they come into the hospital, rather than the same old thing, they park in the hospital, they get their keys out of their car, they get their pet, and they walk in there, and they enter this stew pot of stress. What I recommend you do is let them come in, leave the pet in the car, go check into reception, and then come back out and wait for their pet until it's their turn to come in. Or if you have enough exam rooms, have them walk straight into the exam room and check them in the exam room. But try to minimize that wait time around, or eliminate that wait time around all those other pets. And also inside there's the doorbell going off and all those crazy sights and smells like that. And then when you get into the exam room with them, you don't have to remodel your whole practice, but remodel your voice. Speak softer. Don't have direct eye contact. I used to get on the floor and, oh, you Fluffy, you the bestest boy, come see Dr. Becker. And I don't do that anymore. And you have to explain to them why. I might glance at the dog and then throw some treats down and wait for it to approach me. So I don't want it to feel threatened. I don't use the exam room table very much. It's more of a yoga mat on the floor. So there's a choice of restraint. There's the choice of where they're going to be examined. There's constant food rewards that we're giving, so that we kind of put the treat into treatment. And those are just some of the low-hanging fruit. It actually goes a mile wide and a mile deep. These processes we have, even for pets that are coming into emergency clinics, pets that are going into surgery. I'll leave with this thought though. Imagine right now in your hospital, the pets that are getting prepped for surgery, and they see the pet. They're usually a prep table, a treatment table with a bank of cages. And so that pet is struggling. The new technician who worked somewhere else a week ago is trying to hit the vein for the first time. The dog's struggling or it cries out. Anal glands are expressed. All these dogs in that cage, they see these pets. They see it, they hear it, they smell it, they feel that pet in extreme distress, and all they're thinking of, I'm next, I'm next, I'm next. You start to get it, just how blind we've been to pets' emotional well-being and when focused just on physical well-being. So, but the way to start, again, as a recap, tell the pet owner to bring him in hungry, carrier flat, don't baby talk him, try not to come in and just wait in reception, and then let us start to do our job in there. And don't be surprised if this veterinarian that you saw lovey-dovey try to coax the cat out of the carrier on the floor with the dog doesn't do it anymore. And that we do things a lot slower, or the fact that we reach for sedation much quicker. Dr. Overall said something a while back about if a pet doesn't take a treat, that's a warning sign you've already gone too far. You know, that's a kind of epiphanies you think, wow, maybe we need to think about sedation way farther. And in fact, that's why on the Fear Free Advisory Board we have 2 boarded veterinary anesthesiologists, because many of these pets are so psychologically damaged that you need to start sedation protocols before they ever leave home.
Yeah, if I could add to that, it is amazing to watch what happens to animals when one animal is distressed. And it goes both ways. Flash used to, just on his routine visits, visit the hospitalized patients at the referral centers where we were. And he would walk over to the cage of the most distressed animal and groom that animal. And you could see it change. If dogs can recognize that, we ought to be able to do that too. And for me, the first thing I want people to do is just stop. I want them to sit quietly, no phones, no radio. I want them to take a good look at their exam room and their staff and the machines that go off. I want them to take a good look at their waiting room and then just watch the animals. How many of those animals are you certain are happy? And I say that because those are the ones that are either bomb-proof or you've done something very right. But most normal dogs are not bomb-proof. And studies, most of them done in Europe, show that you become more fearful the more frequently you go to the vet. And that means that part of that is actually the experience of going. So I want people just to sit. And I'm a big fan of a chair or a bench or whatever you're comfortable with for the doctor and the technician in the exam room. And they need to have the client sit down and, you know, unless the dog initiates interaction with you, like Marty said, quick glances, talk softly, use the dog's name so that they know that you know about them. But just take a deep breath for a minute and watch what's happening and then decide the next step. That may be the first time you have the conversation where you say, is that dog always under the chair when you go to a vet's? Because you might not have noticed it before because you would have sent the technician to drag the dog out from under the chair. But if everybody stops, and this is something Flash did teach me, that you can't take in information if everything's busy and in motion. And if everybody just stops and waits and watches for a few minutes, the path to dealing with that becomes a lot clearer. It may not be less complex, but it's easier to do.
I think you've kind of got just your idea of stopping and listening. But I guess, are there some unexpected sorts of fear or stress in patients around the veterinary clinic?
Yeah, it starts pulling in the parking lot. You know what? I remember as a kid going into the dentist we had, the family dentist, and think of this too. Although Dr. Overall's been pioneering this for 20 years, the humans were way ahead of us. She's working at 19, and I don't know how old you are, Dr. Karen, but at 19, and they were doing this at Children's Hospital of Philadelphia, and my granddaughter goes to a pediatric dentist. She loves to go. I hated to go to the dentist. She loves to go. I mean, there's this comfortable chair, there's fragrance, there's beautiful lighting, she gets her choice of videos or music or both, she gets incredible gifts. She can't wait to go to the dentist. So they changed. We haven't changed. But one of the things we've done in this 5-year journey figuring things out, they used to come up to a vertical surface at the clinics and smell cortisol. It's basically like going into Fight Club, you know. You're going in for WWF or worse, the martial arts forms when you're a pet. What we do now, if in North Idaho Animal Hospital, I'm going to be practicing there next week, we have them text, stop and text us and tell us that they're like 2-3 minutes out. We'll actually put treats in the airlock. You know, so you have a double set of doors, there's an airlock. So the first thing the pet finds if it's coming in for a wellness visit is the treat that pet likes the most. So it's specific for that pet. The treat that we know that like the most is going to find waiting for them inside the door. And then when they come in, when Dr. Overall talks about being quiet, you can't have that doorbell going off and on. You have to have a different way to alert you. It could be a light source or under the desk or something that is not that same thing they alert to all the time. That you have more insulation in the better hospitals. You can't have those pets that are crying out in the back, like fighting, stressing. Those pets, they know exactly what's going on. And the more pets you can get in the exam room, the less. And in that exam room, I was actually talking to, everybody knows Shoreline, I think, and I was talking to Joe Schroer yesterday. We're working on a prototype of new fear-free equipment, and the exam room table, fear-free exam room table of the future, is going to fold up or down so it can take no space. There's going to be rubberized floors in the exam rooms. And that heated surgery table, it has heat in it, so it's basically a surgery table it's modified. So it's a heated exam table, and it has a way to clamp a standard-sized bath towel on that table. So you've got a hot bath towel impregnated with pheromones. On the front of this, there's stairs or a what would you call it? A ramp. And it's interchangeable, so you can move it from exam room to exam room, or you can put it in the treatment room. So if the pet wants to go up there, it can walk up the stairs or up the ramp onto this heated towel, and that's where it's going to be examined at. There's so many causes. This person, that dog that's coming in for a nail trim that's always gone through that door to have its nails trimmed with the pile of text back there, that door is an anxiety trigger. Or that person that, Dr. Overall just talked about a minute ago, that it was the one that had to drag it out from under the carrier, out of the carrier last time, or under the chair, that person is a stress trigger. So you start to understand this pet, once you start knowing signs of fear and anxiety, and contrastly, you know the signs of a calm pet that feels safe, then you start to individualize it for this pet, and you get this history. This is where the pet wants to be examined. This is where it should be, rested at. It should be in the parking lot, in the exam room, or it's okay for the reception area. This is the restraint method. I don't know I don't like that word restraint either, Karen. Help me come up with something different. But whatever method we use, we know its tricks and we know its cue words, and it's the tricks it knows and its cue words. So I've seen that happen so many times. These pets become stressed out, and you simply call it by name. Charlie, sit. And here's its name. What? That's just me. Sit. Oh, I know how to do that. And you give it a treat, and all of a sudden, tail's just a wagging. It can be that simple.
You know, it's interesting because it so much depends on the individual animal. And the people don't really know that it's okay to be concerned about some of the behaviors that their dog or cat is exhibiting. They think that that's normal. And for cats, the biggest stressor is usually the carrier because it only comes out at certain times. For dogs, it can be lots of things. It could be proximity. We have a specialist we take some of our dogs to because I don't treat my own dogs. I love them too much. I'm emotionally involved. I pick excellent specialists whom I know and some of whom I've trained. But, you know, 3 of the 4 of my dogs start howling when we turn onto the street. They're not howling because they're distressed. They're excited to see this person because they always get fawned over at that practice. Many, many, many people have gone to this. We've been teaching this at the North American Veterinary Conference Institute course for years, and all of the people who have done this now say that the dogs and cats just run in to their practice. Carolyn Apker's in Minnesota, and her entire practice for years now has been completely fear-free and very calming for the clients too, so that the clients want to go there. In fact, my resident said, I went to Carolyn's practice and I didn't want to leave because I was finally calm. Dennis Doherty in New York, who teaches at one of the technicians' colleges, he says dogs run in and they sit right in front of his refrigerator because he knows, you know, they know there are things there that are good. Steve Brammeyer in Missouri completely changed the design of his practice and the way he practiced, and then had to justify thousands and thousands and thousands of dollars of food treats to his accountant, you know, because that's not the stuff we tend to think about. I think that I know that dogs offer a lot of behaviors. So when I'm doing an exam on a fearful dog, I let them offer me their body parts that might not be in the order I was taught to do an exam. But if you're calm and you're chatty and they're calm enough to take a treat, or they're just curious, you can actually get quite a lot done. The toenail issue is, oddly enough, one of the biggest problems. I have had vets say to the clients come to me recounting the story that the dog is seeing me for an aggression problem because the veterinarian says that because the dog tries to bite them when they do their toenails, the dog should be euthanized. Okay, toenails are extremely painful. It's not for nothing that we view ripping out nails as torture. Okay, think about cutting veins and think about not just that, what you're doing to the leg. Notice that every time you pick a dog's leg up, the dog, no matter how great, always backs up a little bit because they're off kilter. The anatomy of canines is they run on 4 legs. They bear weight on a toe that's not the toe we bear weight on. You know, and these are important things to them. And if you have to pick up their foot and then to get the clippers in there, depending the type of clipper you're using, and then for me to be able to see or to lean over, by now I've put so much torque on that joint that if that animal had any pain, let me tell you something, I just taught him that I was one of the sources of it. So one of the things we actually do is something that a trainer and veterinarian who'd taken the course at the Institute in Florida did, and if I've already got a pathologically fearful animal with its toenails, we teach them to do them themselves on inclined boards of sandpaper. And they're clicker trained to scratch their own toenails front and back, or to walk on a little treadmill with sandpaper so that they wear down their toenails, and they do brilliantly. And if they're not to the point where they're that scared, and you know, these simple things, how would you cut a dog's toenails if there was no restraint possible? See, this is the question Flash made me ask. This is what I mean when I told Marty, you know, I didn't argue with enough of my colleagues. I'm sure my colleagues felt like I argued with everybody, but I didn't argue with them enough. I didn't have the courage of my convictions until there was Flash. And I loved him so much that I couldn't take the chance that he would bite anybody. And that meant that his needs had to be met. I was done negotiating. This is what he needed. And if you think about what you could do if you had no choice. I had no choice with Flash. We could not do anything that would distress him, because if he bit somebody, he was dead. What would you do if you had no choice? What if you weren't able to pick up the dog's foot? What if you weren't able to turn that dog over? Well, many dogs will roll on their side for a treat, and all you have to do is stabilize the foot rather than hold the leg, and you may trim the toenails upside down. A lot of dogs will let you do it standing, especially if someone's giving them treats or rubs or something good. A number of dogs will be very happy to pause on their way down the stairs, and when they do that, their toenails slide forward, and you can cut them on the stairs. And you don't have to worry about any of the other stuff. The same with blood. Students used to joke that they'd have to pick me up off the floor after we got blood from a dog, because if I needed blood and that dog was still worried at the end of the appointment, as the clients were walking the dog out the door and as somebody was talking up the dog and giving him a treat, I'm holding a back vein with a butterfly catheter, and, you know, the dog's still walking and I'm getting the blood, and I'm stretched out to my full 5'2" length by the time we're done. But we got a tube of blood that wasn't traumatic for the dog, and it was amusing for the students, which is a good thing. But there are ways to do this. And I think that the fundamental question here is, what would happen if I wasn't allowed to do this? What would happen if I couldn't do this? And I think that what I hear from vets is that they have 12 and 15-minute appointments, and they're really hyper about that. This is what I learned 25 years of practicing behavioral medicine. In behavioral medicine, you're stuck thinking on your feet. If you do internal medicine, you send off a lot of lab work. We call that time to think. You need to take that time. If it takes you the entire 15 minutes to just think about the behavioral issue in a way that won't make the dog worse and you can get through to the client, that's fine. If they're in a hurry, maybe the dog could stay and they could pick them up later. If they're absolutely insisting that they don't care about this and they don't want to sedate the dog and the dog must have a vaccine, I have to tell you I wouldn't do it. Not because I don't believe in vaccines, but if we're already to that level of arousal with a client who doesn't understand how distressed this dog is, at some point I may get around to selling my ethics, but that's too cheap. I'm not going to do that to that dog. On the other hand, a ballpoint pen can teach a dog how to take a vaccine in no time at all, and I send my clients home with syringes and ballpoint pens, no needles, and they can begin to manipulate the way we would give a vaccine. And in fact, tomorrow I see one of the dogs who was the worst for this for a re-exam. And he's now able to go into the vets and be vaccinated, no restraint, somebody holds his head, he can have blood drawn. He's still a little worried, but he's not even sedated for the appointment. And I think if we started to do this early, if we had the philosophy early on that Children's Hospital did, that kids participate in their health care, that they're cognitive beings, and no matter how young they are, they tell you when they're cold or when they're wet or upset. I mean, anybody who's held an infant knows that that kid is cognitive. They may not have full myelinization of their brain, but they are cognitive. Dogs and cats are the same way. And if we watch what it is for them and get the clients to watch, I think that we could prevent most of this, and that's one of the things that's showing up out of the European studies. I'm involved in a study right now that's very interesting and looks at behaviors as they change through a veterinary exam. And we very stupidly, and I can say this because I mostly designed the study and it was a really stupid mistake, of the 12 things that we're evaluating, for some reason I didn't notice that taking the temperature rectally got put in as number 11. And in fact, what that means is the dog calms down throughout the visit until we get to the temperature, and then that's it. It's over for most of these dogs. They're panicked. Now they don't know what to do. Nobody knows what to do. They're worried. They know they're not supposed to restrain the dog. They're worried. The temperature, their heart rate spikes, and it almost doesn't matter what the next thing in the test is because they're overrun by the temperature. And yet, we need an accurate weight and temperature in many states in the United States for this to be a valid medical record. And those are two things that scare the hell out of many animals. You know, the getting on the scale or having their temperature taken. We can deal with the temperature quite easily, in fact, and it's done in working dogs all the time. We can feed these dogs thermistors that they'll defecate out. If the veterinary community as a whole went for this big time, the research cost of these is $5 a piece plus the software. If the veterinary community went for this big time, you would get nonstop downloads of temperature data for a dog for 3 days. You know, we don't think about that. How valuable would that be for the hospitalized animal who's already painful, already sick, and maybe you don't want to shove a thermometer up its butt right now? We do this in working dogs to test them for heat stress. That type of thing needs to come in to our basic care and into our hospitals for hospitalized animals. Marty talked about not allowing the patients who were coming for preventative care to hear the hospitalized patients. Well, the thing Flash taught me was those hospitalized patients can be calmed down. And I walk through a lot of hospitals, and I have to tell you, if I hear a dog crying from anesthetic, I find somebody, and it could be a client, if there are no technicians available or I can't do it, and I have them lean against that dog until the dog calms. Because they work themselves up and work themselves up and work themselves up. And this is the value. You know, Marty's designing a new table, but there are things we can do now. You can get buckwheat wraps and doorstops and put them in your microwave. Everybody's got bottles of seltzer or soda. Put hot water in it, wrap it in a towel, and make a little nest for these guys. Lean on them until they stop crying. Calmly, talk calmly, lower the lights. Decide you're not going to have a recovery room full of screaming animals. They don't have to be screaming. They could be calmer than that. There are lots and lots of clever things we do, and one of the things that I did for Flash, and after that all my dogs, is I taught them how to get on an exam table even though I never used one. I taught them how to walk up, and not all exam rooms have step stools like Marty's talking about, or ramps, but they often have chairs. So I would teach them to jump from one chair to the next chair to the table, and then they had to do something cute that would make the staff laugh. And it could be anything. Flash's signature move was to put out his arm for lab work and then turn his head away as if he couldn't stand the sight of blood. But they got up there themselves, and they put their arms out themselves. And Pick offers his belly himself. And if you need to see him fully stretched out, he can do it lying down. He can do it sitting in a sitting bear posture. You can put your arm out, and he'll stand up and lean on your arm so that somebody can do anything they want to his belly, and nobody restrained these dogs for anything.
I think a big part of the fear-free thing is getting also the team involved. So what do you think, what is the team's role in this?
Well, I'll tell you what we do, and I'll tell you what will happen in the hospitals I work at next week. And again, there's so many things that have been mentioned today, again, about you know, just the way you draw blood or the way you trim nails. I live 45 miles away from where I practice, and so I put my schmuck out there, my white lab coat. I spray it with pheromones so the alcohol is dissipated. I get my deli turkey in my pocket and head to the clinic. And when I get there, you know, first thing I do is I stick that turkey in the microwave and heat it up. So we've got literally, we might have 10 treats in the exam room. Peanut butter Captain Crunch, Honey Nut Cheerios, liver treats, Zooks Minis, you know, natural balance rolls, all sorts of things in there. But when we have somebody, I actually work with a pet massage therapist, which I know is out there, and I'm not recommending people start out this way, but I actually have Julie Crispina with Rollover Rover Pet Massage go in first before a nurse or technician goes in. She does body work on the pet. Then the nurse or technician comes in, and then we come in. I should mention that if she's not there, we try to let the dogs have 5 minutes and the cats have 10 minutes alone with the kind of quiet that Karen talked about, so they get a chance to settle in. And there's a little sheet that describes, you know, what's this music that's playing? You know, this was designed by a veterinary neurologist to calm pets. You know, what's this coming out of these dispensers in here that you see plugged in? Why are we, you know, have a yoga mat on the floor and might not examine the table? Why might Dr. Becker not get down on the floor and make himself go crazy again? Why might we stop the exam and start sedation if this pet gets over this threshold? And then the technicians coming in, this is something I learned from Tony Buffington at the Ohio State University. They give up to 60 treats in a 15-minute wellness exam. And I first heard that, and I'm like, what? I thought we were given like 15 treats. I thought that was a lot. 60 treats in a 15-minute exam. But it's little tiny bits of treats, but it's basically, rather than augering the pet through the system, you're augering treats into this pet that is so mesmerized by this. And Dr. Overall made another good point. I used to always start at the tip of the pet's nose and end up at the tip of its tail. Same way every time. I don't do that anymore. In fact, for cats, I always start at the tip of the tail. I don't want to be hoovering around its head. I never, ever, ever look it in the eye like I used to. But whatever that pet presents to me, that's where I start. And especially if it's something painful, I tell the pet owner, listen, I'm going to look at this at the end so I make sure I don't miss anything, but I don't want to cause that stress. And something that's being done, you know, Dr. Overall talked about this thing with a ballpoint pen and a syringe. My daughter Mikkel and some other trainers, they work now to take these puppies and kittens. They use a syringe so the pet actually sees the syringe. They feel a fold of skin. They do this at home, basically, so it's, you know, an at-home vet clinic. You pull the skin up. You put pressure there. You use the syringe, give them a little bit of a tuna juice or beef bouillon juice for a dog in the cheek pouch so they're used to that. You take a little bit of pill pocket and you wad it up in that ball and you put them in the pilling position so they're sitting down, their head is tipped back, their jaw's pried open, it's put over the base of the tongue. Hey, that tasted good. Wow, what is that stuff? So they get another one. So now they think this position with this medication in this little ball or this pill pocket, this is good, not bad. And what we're starting to do now is take a Q-tip for the ones that are adventuresome enough, is actually take a Q-tip, lift the tail up, because like Dr. Overall talked about the nail trims where they want to pull back. Every time you lift the tail up, they sink down. So you lift the tail up, you give them a click, and you treat them. So it's clicker training. And then you touch the anus, they get a treat. And then for the adventuresome ones, you can take that Q-tip and actually put a little KY or Vaseline and actually penetrate a little bit and get a treat. Washington State University's College of Veterinary Medicine has counter-conditioned almost all their pets to have their temperature taken. And so I started doing this the last couple of years, and it's pretty funny when you see dogs that you counter-conditioned. It doesn't take very long to do, by the way. Some of these dogs, 90 seconds, 2 minutes to do. When they come in and they see you're going to take their temperature, they actually present their you-know-what to you. They lift their tail up, and they stick their you-know-what right in your face. We laugh every time. But now, rather than that step 11, that their heart is pounding out of their chest, they're sinking down, their legs are trembling, they want to have their temperature taken. So,
Marty, can I interrupt here because that's a great point. Here you've got dogs that don't have a problem yet, and they are very easy to teach that they don't need to have a problem. I mean, this is where time is cheap. Because, you know, all of my dogs present their butts. You know, that's the word I say. Let me see your butt. It's for whether they went outside, they got wet, they had diarrhea, we need to take a temperature. And, you know, for animals who have already had a bad experience, we use lidocaine to empty anal sacs, you know, topical lidocaine. So you know, you gradually ramp it up. My new text manual that came out in 2013 has a large section on all of the things that people should do to their puppies and kittens at home in a humane way. If vets can implement that themselves, trust me, a good certified trainer could. And, you know, that's not a community that veterinarians are that comfortable reaching into. But in this case, if you've got a positive trainer, and you can look at the Pet Professional Guild, which has an oath about not doing anything forceful or abusive, if you can find a really excellent trainer who can explain to your staff and your clients, or give you the language, you know, you can prevent the puppies and the kittens from having problems. And then by the time you're done, you just have the ones that are truck wrecks because they got that way over time. One of the other things you said is just put the dog in an exam room if you can, and leave the dog for 10 or so minutes. Dorothea During, who's a researcher in Germany, has looked at this, and dogs left 15 to 30 minutes are actually much calmer. So even if they became aroused coming into the practice, if they can get into that exam room, and she's published this, if they can get into that exam room and sit, they will calm over that period of time. The other thing that some research has shown, I edit the Journal of Veterinary Behavior, Clinical Applications and Research, and we just published a paper about 3 months ago that showed that, in fact, perfectly normal dogs who have been screened not to have any behavioral issues, don't like having their head reached over or their head touched. If you're going to do that, you do that at the end of things, coming from the back, not going forward. Well, if you think about how well dogs see super close, it's an issue. Now think about all people sticking their nose in their face in puppies and kittens or young dogs that they think might be cute. Or ferrets. Most people only do it to ferrets once, and then they know why no one kisses ferrets that they don't know on the nose. But they don't like this. And this study looked at heart rate and body posture and whether the dogs were physiologically stressed by the manipulations. And the big shock was petting them on the head. No, dogs, even normal dogs, don't like it.
You know, Karen, I might jump in there. That's one of the things that I've really learned. We always started eye contact with the dog or cat, contact with its head, trying to rub it or rub the side of the cat's cheeks. You don't do that. You don't want to look, you don't want to hoover over the dog or cat's heads. You want to have be towards the side. Again, on cats, we start in the back and work our way forward. We don't pet these dogs on head anymore. We don't even pet them along the back. We pet them along their rib cage or the sides of their necks. There's other places that are better to pet. So I think if there's a couple things that all these team members could change is, one, don't hoover over these pets. Don't get in front of the cat carrier and look in there and try to coax it out. It's not going to come out. In fact, there's a new carrier called the Navigator Kennel by PetMate that I helped design that you can put it together and take it apart in 30 seconds. Very quietly. So it's a great carrier for pet owners to use or you to have to lend to them. Don't hoover over them. Don't stare in the front of the thing. And also make sure these pets come in hungry. Have them come in hungry so that they respond better to food rewards. So that's one of the things that everybody can do. And don't have the eye contact and come here and expect them to come take it out of your hand. Throw the thing on the floor. Let them come over and find it. Throw another piece, and pretty soon they'll be waiting there. They'll appreciate that eye contact. Then you can give them some. Don't be in that big a hurry to start that exam. But what we're doing right now that we don't realize how scary it is wanting those pets to come running to us and have them choose us and come over to us from behind the exam room table when all we're doing is increasing their fear. Talk to the pet owner. Throw a little food down, let them start to warm up, talk about the medical history again, get a better idea there, and let things calm down. And again, you're going to find things that the TPR is more normal, the physical exam is more normal. There's so much more satisfaction from it. And we actually have pets, when she was talking about her dogs howling, you know, now when they go by the specialist, We have so many people now that talk about when their dogs drive by. They go by Highway 2 in Sandpoint, Idaho. It's a busy road, and the dogs will see the clinic and be pawing at the window to get to the clinic. That didn't happen before 4 years ago. And I can't say there, you know, cats aren't pawing at the window or crying to get out to go to the vet hospital, but I think what we've achieved at these hospitals is the dogs, in large part, want to come to the veterinary hospital. And the cats are okay with coming to the veterinary hospital. You know, we've decreased that stress or anxiety. And the one thing I would hope in this thing that we would get out of it, and this is something, again, when going back 5 years ago, and Karen said, fear is the worst thing a social species can experience and causes permanent damage to the brain. You can't look past fear or anxiety. Just like you would not look past a medical condition, you know, this pet has a laceration, or it has a roaring infection, or it has an infected anal gland, or it has a split nail or staph underneath its feet. Don't continue arguing them through the system. Many of these pets now for nail trims, I think that's the worst example I've seen, is the dog that always comes back and is traumatized. It goes through that door in that spot with those technicians holding on to it, with that drawer you get the nail trimmers out of. What I would reach for there is trazodone. You know, we use a lot more, and Karen's taught me this. I was always so hesitant to reach for some of these things. Why? Well, why would you be hesitant to reach for the things? It'd be like, you know, I have a son that has anxiety, and he has to have a medication for anxiety. It'd be like denying him the medication for anxiety. So many of these pets now that are psychologically damaged, they start on GABA, buprenorphine, or trazodone. It's cheap. We use a lot of alprazolam. It's cheap. It's safe. And why the veterinary profession lets pets be freaked out by thunderstorms and fireworks and gunshots in hunting season, where these pets think they're going to die, when we have a simple, safe treatment for them. And, you know, instead they're going down to the neighborhood pet store and getting something that says veterinary recommended that doesn't work.
Right.
So I get kind of fired up about this, but we really have a moral obligation to look after these pets' physical and their emotional well-being.
Marty, you just made the most important point. We do have that moral and ethical obligation, and we may not have been trained to do some of the things that entails, but veterinarians should feel it incumbent upon them to be comfortable enough with this, to learn enough, to make it as much of their own as possible, that they can actually say to the clients, you shouldn't be going to the pet store for that piece of information. You shouldn't be buying the thing off the shelf. Here, I'm your source. I mean, you're not going to say this, but the client should realize that you're the source for good quality information. And one of the things that vets don't realize, and you said it, but you didn't call it this. You know, I do research. I collect data. It's the way my brain is wired. You were talking about seeing if they would take the treat. Well, I might put down treats and watch the dog's behavior, because what you're really doing is collecting data. Or I would sit quietly and watch and see what the dog did. So it's not so much that I want to give him a treat. I want to see what he does with it. I want to see what he does if everybody's quiet. I want to see what he does if I put down a blanket that a calm, happy dog has just laid on. You know, there are all sorts of things you can do, but if veterinarians would view these opportunities and exams as ability to collect data, they will then be able to objectively measure whether their interventions behaviorally have made a difference. And clients, once you explain this to them, because it can be hard to find good levels of some of these medications. I mean, people come to me because they know their animals need psychotropic medications, and that's why they're seeking me out. So pretty much all my patients are on medication. That's not the case in your average hospital, and people need to get a comfort level, like you finally got, with drugs. And I know I jokingly say drugs early and often, but I mean it, because that pain and suffering, there is no suffering that's as bad as mental suffering. There is nothing to equal it. And clients may have to poke around and try this medication and that one, and 2 hours before, maybe 12 hours before, if they understand what you're doing, if you can be that kind of research partner for them, where their pet is in the clinical experiment to get happier, they'll do it.
Dr. Overall, I know we're running out of time. I just want to say for everybody out there, you should buy her book. I love
Marty,
her
you've
book.
already said I scare people.
Well, they can read your book, then you won't scare them.
Oh,
no,
God.
I love her book. I love her book. I love her book. And again, this is an unprecedented, an urgent obligation, an unprecedented opportunity. You're going to do good by doing good. I am a capitalist. I love to make money because it shows you're providing something of value. And these practices that are doing fear-free are doing exceptionally well by doing good.
They are. They are.
Well, and you're correct. We are kind of running out of time, so I thank everyone for attending. This has been our Fear-Free Hangout on Google+. I'm Mindy Valkersel, the editor of Veterinary Medicine. Again, I want to thank Dr. Overall, Dr. Becker very much, and also everyone that has been attending online. You can access this on-demand recording of the Hangout starting tomorrow. It's going to be at that same address that you might have signed up on, dvm360.com/fear-free hangout, all run together. And you can also find DVM360's complete coverage on fear-free. All of our May issues covered this quite a bit with the participation of Dr. Overall and Dr. Becker at dvm360.com/fear-free. So thank you, everyone, and have a great day.
Thanks, Mindy.
Thank you.